For over 100 years, we've looked at plasma and plasma-containing antibodies as a potential cure or therapy for people who are actively infected with a virus. Convalescent plasma is from patients who have recovered, who have actually been sick and then recovered from an infection. In this case, we're talking about COVID-19. Plasma contains antibodies, which are thought to be effective in helping to neutralize the virus.
As an ICU doctor, we use plasma all the time. And the side effects from plasma are the same as getting any kind of blood transfusion. It is not something that is coming out of a lab where we don't know what the side effects are, and the data has proven that it does not have any major side effects. So as long as there is no other treatment and there is something that is very encouraging, something that is safe, and something that is available to the patients, we should always be trying that.
So one of the great things about the convalescent plasma treatment is that so far in the experience, we really have not felt like there have been a lot of adverse reactions in people who have received the plasma. We know traditionally that plasma is not a high toxicity type of treatment, so we have a lot of confidence that this is safe.
It is very important for people to donate plasma so we can have this treatment resource for patients who can benefit from it. And we are very lucky in the tri-state area to have a blood bank that is able to do that job.
Hoxworth Blood Center was one of the early blood centers to be able to provide convalescent plasma in the face of the need for COVID-19. We really didn't know what to expect when COVID-19 happened. We were very pleased that donors responded the way they almost always do in the face of tragedy.
I was the first patient to do the donation for plasma. I love helping people, and I know that if I do it for someone, somebody will do for me or for my family. Since we did not have any vaccine, any solution is the good solutions.
FDA has been great in providing us with some guidance in terms of how to collect this product so it's both efficacious and safe. We ideally will have a patient who is recovered who was tested for COVID-19 infection while he was sick, and if that's positive, then we wait until they're symptom-free or their symptoms have resolved for approximately 28 days. So then we have confidence that the patient has recovered and will not pose any risk to our staff as we collect that person or to the recipient, and that they will actually have antibodies that are effective for COVID-19. Actual donation time is relatively short, about half an hour to an hour.
I'll be honest with you, I hate needles, and I was nervous. Never done this, but it's so easy process.
Donors can typically come back once a week for up to 4 weeks, and then we'll ask them to wait 28 days in between donations.
And the best part is how you feel after that. I felt so much energy and feel so good, and I want to do it again. So I did the second times, and I did third time, and I did the fourth time.
While we go on this journey with the patient, I always like to remind them that plasma was one of the things that probably helped them, but it's very difficult to say that plasma did not help these patients, because a lot of these patients were at the door of getting on a ventilator, and they kind of improved. Once again, the end data will speak for itself, but it's very gratifying to see patients actually improve either from this modality or any other modality.
Definitely, I recommend, encourage people. We have about 2 million people have COVID-19. And many people, it's getting better. But if they can donate their plasma, they can help a lot of people. There's no vaccine at this point, but this plasma donation can save somebody's life.